Hello everyone, my name is Kayla and I am a registered dietitian nutritionist at San Antonio Regional Hospital. Today we're going to be discussing maintaining a healthy weight through exercise. In this presentation, I will be reviewing the American Cancer Society and the World Cancer Research Fund American Institute for Cancer Research recommendation on physical activity. After cancer diagnosis, unless otherwise advised and if you can, all cancer survivors are advised to follow the cancer prevention recommendations as far as possible after the acute stage of treatment. The first recommendation is maintaining a healthy weight throughout life. BMI stands for Body Mass Index, and it is a ratio of weight to height. Normally, a BMI range of 18.5 to 24.9 is considered healthy for adults. However, after the age of 65, a BMI of 25 to 27 is also acceptable and may reduce the risk of osteoporosis. There is evidence that being overweight is a risk factor for numerous types of cancers such as breast, colorectal, endometrial, esophageal, kidney, and pancreatic cancers. Being overweight also increases the chance of reoccurrence and lowers odds for survival. This is an example of a BMI chart. We don't need to do any calculations, we just need to match the height to weight. For example, for someone who is 5 feet 5 inches and 140 pounds, we would first find their height, 5 feet 5 inches, and move along until we could match it with their weight of 140 pounds. We would see that they would have a BMI of 23, which is in the healthy range. If this same person was 160 pounds, we would see that they would have a BMI of 26, which is in the overweight range. However, if this person was over the age of 65, this would still be acceptable. A major downfall of BMI chart is that it does not account for muscle mass. Another screening tool which may help estimate potential disease risk is measuring your waist circumference. This can help identify excessive abdominal fat, which is linked to several diseases. The World Health Organization, or WHO for short, measures just below the rib cage. Per the WHO, men should have a waist circumference of 37 inches or less. Women should have a waist circumference of 31.5 inches or less. The National Institute of Health, or NIH for short, measures waist circumference just above the hip bone. The goal for men is less than 40 inches, while for women the goal is less than 35 inches. So it depends on where you measure for measuring waist circumference. Per the American College of Sports Medicine, exercise is important for all adults in cancer prevention. Exercise specifically lowers risk of 7 common types of cancer: colon, stomach, esophageal, bladder, kidney, endometrial, and breast cancers. For cancer survivors, incorporate exercise to help improve survival after a diagnosis, especially those with cancers of the breast, colon, and prostate. The third key point is that exercising during and after cancer treatment improves fatigue, anxiety, depression, physical function, quality of life, and does not exacerbate lymphedema. As you can see, there are many benefits to physical activity. The recommendation is to get at least 150 minutes per week of moderate physical activity. This type of exercise raises the heart rate to 60 to 70% of maximum, such as brisk walking, swimming, or mowing the lawn. Your breathing should quicken, but you should not be out of breath and should still be able to carry on a conversation. You will likely develop a light sweat after about 10 minutes of moderate physical activity. If you prefer to participate in vigorous physical activity, it is recommended to aim for about 75 minutes per week. In vigorous activity, your breathing will be deep and rapid, and it will be difficult to carry on a conversation without pausing for breath. It will only take a few minutes to develop a sweat in vigorous intensity exercise. It is not clear if daily activity provides the most benefit if done all at once or in smaller blocks of time throughout the day, but it is reasonable to get your activity in separate sessions of 10 to 15 minutes each. For people who are not active or just starting a physical activity program, activity levels below the recommended level can still help your health, especially your heart. However, people with chronic illnesses such as cancer or risk factors for heart disease should check with their doctors before starting a new physical activity program. There are now many online fitness programs if you prefer to work out in the comfort and safety of your own home. Many fitness videos and programs are of little or no cost. Every little bit of physical activity helps, especially if you're not currently getting any exercise at all. In fact, the American College of Sports Medicine guidelines emphasize that every cancer survivor should simply avoid inactivity. Above are some examples to help you get moving and limit sedentary behavior. In essence, walk more and sit less. Start slow and have fun. Every little bit helps. I hope this presentation motivated you to improve your physical activity and work toward maintaining a healthy weight. Stay tuned for the next presentation where we will discuss achieving and maintaining a healthy weight through nutrition.